Okay, we are live.
Thank you there. All right, good evening, everyone. We'll just do a quick roll call and get right into it. Ms. Dominique Johnson.
Present.
Mr. Thomas Keegan.
Here.
Manny Langella is absent currently, and Manny Langella is joining. We'll go back to him. Ms. Diana Revolus.
Here.
Ms. Lisa Shanahan.
Here.
Mr. George Sirenides.
Here.
Nick Sachinelli is here, and Manny just joined. Manny, you on?
Here.
Hey. All right, we have full group, and we also have, for the record, Mr. David Huberman joining us for the evening. So we haven't met in some time. So the holiday, this always happens with this committee, and one day we'll probably change what day it falls on, but we always have a meeting on Christmas Eve and then Thanksgiving Day. So it's good seeing everyone again back in this group. And we'll just go through the agenda briefly. We have to do the approval of the minutes, and then we'll go right into public participation. If we have anybody, does anybody want to move the minutes of October 22nd, 2020? Ms. Shanahan, thank you. Any discussion, corrections, omissions? Not seeing any. Vote to approve the minutes of October 22nd. All in favor? Opposed, abstentions? All right, looks to be unanimous. Thank you. Larry, do we have anybody from the public?
We have 3 people on. If anyone would like to speak, please raise your hand electronically now, and I will unmute you. I don't see anyone raising their hand.
All right. Then we'll move on. All right, so action items from the police department, 1A and 1B. Authorize Mayor Harry W. Rilling to execute any and all documents necessary to apply for and accept grant funds from 2021 Connecticut Department of Transportation DUI grant in the amount of $61,400. Item 1B, authorize Police Chief Thomas E. Koholic to execute any and all agreements, documents, instruments, and amendments thereto as may be necessary to implement all programs through the 2021 Connecticut Department of Transportation DUI grant in the amount to up to $61,400 pursuant to such grant funding. Do we have a motion? Mr. Sirenides?
So moved.
Discussion. Does anybody want to speak to the item from the police department?
I can speak to it. This is just a standard grant from the state for our DUI enforcement. Normally, this grant would have started in November, but because of COVID, they keep pushing back the start date of it. So.
Thank you. Any questions regarding the grant from the group? Straightforward. We have a motion on the floor. All in favor? And that looks to be unanimous. Thank you. All right. Item 2A. Authorize the city's purchasing agent to execute a purchase order on behalf of the police department, MHQ Inc., under contract number noted for the purchase of 12 2021 Ford utility interceptors, all-wheel drive, for the amount not to exceed $428,993, account noted. Anyone would like to move the item? I see Mr. Langella. Discussion. Anyone from the police department like to speak on this one?
And I can, this is also a standard. It was in our, it's in our operating budget for our marked patrol vehicles. So it's our standard purchase.
Capital budget.
I'm sorry, you're right. They changed it from operating to capital last year and actually this year, and I apologize. In the capital budget, there are funds.
All right. Discussion. Ms. Johnson.
Just a quick question about, I'm presuming that if the funds aren't used in the capital budget, they cannot be used in the next fiscal year. Is that correct? Like it's got to be used this year?
That
No.
is really up to finance.
That's wrong.
They can hold them, and actually we have used funds, as long as it's used for the same purpose.
Okay.
The finance department can't authorize a carryover. For vehicles, we usually don't have funds left over. We usually go over, to be honest with you. And we have to supplement with some operating funds or other sources. But as long as it's used for the same purpose, it'll stay for several years.
And are these part of that new program for having more environmentally friendly vehicles?
These are not hybrids because at the time we didn't have information to verify what the quality of the vehicles and if the fleet could support them. Next year's vehicles that we budgeted are hybrids, but these are traditional vehicles.
How long are these vehicles that you would be purchasing this year going to remain in the fleet? What's the average use time, you think?
They'll stay with us 10 to 15 years. They'll be frontline vehicles for several years, then they become extra work vehicles. Some will go get repainted as detective vehicles. That we use up their lifespan, believe me. They're in our fleet for probably 10 to 15 years.
Okay. So this is actually a purchase that's been in the making for a while, I assume, if that's the case, that these are.
Yeah, several. The old finance director had started us with a program to prepare a annual budget of what our vehicle fleet would be to keep it within 5 years of service of frontline vehicles. And that's what this is. It just represents what this current number of vehicle bid should be.
Thanks very much, Chief and Deputy Chief. Yeah, I know it's been something that people have been talking about to make sure our fleet goes as electric as possible. So I just didn't know if that was happening this year or the next.
Yeah, unfortunately, because the budget's done so far in advance, we were concerned about budgeting for hybrids without any experience from other departments. So we wanted to see what other agencies experienced before we went ahead and jumped in, and then we're stuck with vehicles that maybe had issues. So we waited, we got some experience from other agencies, and then for this year, for next year, for the new budget, that's what we're looking at.
And are those more expensive I don't know if you've looked.
They're about $4,500 per vehicle more, plus the warranty.
Got it.
But we're told that over the lifespan, they're actually going to be cheaper because of the savings in gas.
Right. Okay.
Because when they're idling, they don't run on gas, they run on the battery.
Mm-hmm. Okay. And yeah, you all have to idle a lot given your work. I appreciate that information. Thank you both.
Good questions. Any other questions?
Chief, are we retiring any vehicles this year? Or?
Yeah, what we do is we cycle out the front line will get moved back. Those vehicles will get moved back to extra duty vehicles. And then some of those extra duty vehicles that are 10 or 15 years old will then get retired by fleet and then surplused out for, I don't know what they get for, not much, but they get surplused out by the city.
Any other discussion? Can you tell us a little about the build out? Has it been updated? Anything good in the build out compared to the older vehicles in terms of radios? I always found that part interesting.
No, they're basically the same. The one big difference is with the new Ford changed the entire body structure of the new vehicle. So starting last year, everything has to be new. Nothing fits from the prior vehicle. So there's we used to reuse some equipment, but it's been very difficult because the vehicles now are different sizes, different width, different length. So that's been a challenge. But other than that, there's not much that's different. Radio system's the same. We've upgraded that already. So we're putting in the new radio system based on our capital budget for a whole new radio system for the whole city. So it all ties in, but other than the radios, everything else is pretty much the same.
Okay. And then the aesthetic, the outward aesthetic, are we keeping all the same color themes and so forth?
It'll be what you saw with last year's vehicles, which is with the gold, with the white outline, that white stripe, the medallion on the back. We redid the graphics after getting some feedback from people. They wanted something a little more, I don't know what the word is. They wanted something a little more aesthetically looking, but we also wanted to stand out and not look like every other department. So we try to, when we see a Norwalk vehicle, I want people to know that it's one of our vehicles and not just whether it's Wilton or Westport or anyone else. So we tried to do something that's a little different.
Excellent. I love it. Thank you. Mr. Keegan.
Yeah, just a question. It's actually related to the police accountability bill. Do we have any issues with dash cams or anything that's going to be required equipment the next?
Yeah, in next year's budget, we actually, not the capital, but the operating budget, we have dash cams for the frontline vehicles budgeted. Because by the bill, they're going to be technically all vehicles should have it by July 1 of 22, I believe. It's going to be difficult for us to do that just to get all those vehicles outfitted. We have a lot of marked vehicles, but starting with next year's budget, we'll get our frontline vehicles all outfitted with dash cams.
Thank you.
All right, any other questions, discussions? All right, we'll move forward with the vote. All in favor? Opposed? Abstain? Oh, unanimous. Thank you. All right, item 3A and 3B. Authorize the mayor, Harry W. Rilling, to execute an agreement with New England Radio Consultants LLC for consulting and implementation services addressing the customer responsibilities and assumptions as outlined in the statement of work within the Motorola Solutions State Tie-in Norwalk Radio Systems project per sole source procurement request for an amount not to exceed $50,000 from the account noted. 3B, authorize Chief Thomas Kahalik to execute change order to the above agreement for the amount not to exceed $5,000 account noted. Anyone want to speak to that? Oh, first, do we have anyone like to move that item? Mr.
So moved.
Thank you. Anyone from the police department like to speak on those changes?
Yeah, I can speak to that. As you recall, or you may recall, in our capital budget, we have funding for a complete rebuild of our radio system, which is a multi-million-dollar project. Not just the police, but police, fire, EMS, Parks and Rec, the whole city. We had discussed amongst ourselves about hiring a consultant to help us make sure we're getting our bang for the buck, so to speak. As we were doing that, unfortunately, our combined dispatch director, Lieutenant John, had an unfortunate medical emergency and is going to be out for a considerable amount of time. And he was the one that was overseeing this project. So it kind of put another take on that we really need to get somebody that can oversee this project. As we were looking at that, I spoke to some other people within my chief's network, and they recommended this individual from Northeast Radio Consultants who used to work for the state designing radio systems. And he's worked with a number of municipalities and including Yale University and others on consulting with them, both on making sure that the design of the system is appropriate and also that the payments that we're making is appropriate. After speaking to him and going over our proposal that we got, it was clear that this was something that we really should look into, because although $50,000, is a considerable amount of money, we feel that he'll actually probably save us more than that, and also guarantee that we get a number one system that does what we need it to do, and someone that really understands. It's a very complex system, and there's very few people that really understand all the ins and outs of it. And just in speaking to him over the phone, looking at our proposal, he brought up so many issues that it was clear that we needed somebody with expertise to really help the city along and oversee the installation and make sure that this is done appropriately and at the best cost. So and one other thing, we also, as the Fairfield County Chiefs Association, has a separate radio system, the FAPERN system, which needs an upgrade. And we're looking to spend about $500,000 through our association to do that. And we've hired the same individual to help us with that system. And it looks like just in conversations, he's already made recommendations that are going to save us money there. So I think this will be money well spent.
Thank you.
To add to that, he'll bill us on an hourly basis. So it will be his actual time worked, not a straight fee of $50,000. It will be for whatever time it actually does take.
Thank you. Excellent. If I recall correctly, with we had a vendor presentation as we were looking at vendors for this. Am I thinking of the same one? No, it wasn't this one.
No.
Okay. I was the design for this, is this for antennas and that structural piece as well, or is this more on the actual infrastructure within the building?
This is a consultant on the entire project. He's going to be looking at the antennas, the power backups, the repeaters, the actual design of the system. soup to nuts. He'll be
Okay.
looking.
All right, so I think we do. I swore we saw a presentation from the vendor that was doing the antenna setup, because I recall asking, maybe I'm wrong, but I recall asking if they're, I see the benefit here, is what I'm saying, using a consultant, because I remember they said that they use computer analysis to make recommendations on where the antennas go. And I asked if we had to move the antennas, if it would be at our cost. Is it a different project?
It's the same project, but you're talking about the actual vendor that's going to be installing the radio system. That's Northeast Communications, Norcom.
Yeah.
This individual will be overseeing on behalf of the city and looking at it from the city point of view to make sure that we're getting not only the information that's proper, but that what they're saying we need is actually what we need. Norcom's a great company. I'm not saying that, but you know, there's always, you know, two sides to a story, so to speak. And, you know, he'll be able to give us his take on the recommendations that they make and make sure that we're getting exactly what we're paying for.
Yeah, thank you. And for the committee that wasn't around for what I'm referring to, so the vendor that we're using had basically described that they're doing computer analysis to make recommendations of where they would be placing the antenna. And if the antennas didn't work as well as we would have needed in that area, if we had to revamp the system, then the cost would be on the city. So in my mind, having a consultant that has that extra layer of understanding and visibility to the project is a benefit. But I want to open up for any further questions or discussion. Mr. Keegan.
Yeah, Mr. Chairman, I have an item I'd like to discuss having nothing to do with radios. Would you like me to bring it up after our vote?
Yeah, or we could wait. Is it for the police department, or?
It is for the police department.
Does it make sense to do it at this time, or do you want to do it during discussion items when we get to the police update and discussion?
Discussion items will be fine. Thank you.
Okay, excellent. So we'll close up this item. We'll move forward with the fire items, and then when we get to the old business and go into the discussions, we'll bring those forward. Any additional questions on this one, Ms. Johnson?
So I'm assuming this person is, based on the packet, is an expert in this particular Motorola brand, the Motorola, you know, gear that is used. Is that right? Like they really know what we purchased or what, you know?
Yeah, actually, there's the individual it's Northeast Radio Consultants, but the individual is Paul Zito is the person.
Okay.
That's his company. He formerly was one of the high-ranking members at the state in their radio system. He helped design most of the state radio systems. He designed our FAPERN system for the Fairfield County Chiefs.
Okay.
He's got intimate knowledge of all we're talking about and is very adept at, you know, what we're doing here.
Excellent. And is this also for the fire department as well, or is it just police?
No, it's police, fire, EMS,
EMS,
Parks and Rec,
DPW.
DPW. It's a whole trunk system that's going to tie everybody together.
That's right. So it's just all dispatch and that's something that's new for our city, is from what I recall, to have
Correct.
as integrated. Okay.
Yes.
Excellent. Thanks, Chief.
Any other questions, discussion?
I had a question, but Ms. Johnson asked it for me. Thank you very much. But they are going to help with the integration of the system, correct, Chief? And if there's any problems along the way?
Yeah, well, we're hoping that with the consultant that we'll avoid problems because he'll see it before it happens, so to speak. And we're also hoping to save money as a result too.
Great. Thank you, Ms. Johnson. You asked my question for me.
Great minds.
About all the departments.
Any other items?
One thing else, if I could.
Of course.
Oh, thanks, Chair. How confident are we that we're not going to need to go back on a change order to change anything up? Because I know it's smart that we're building that in a not to exceed 5,000, but we're pretty confident that we're not going to need to do that, or is that you're probably not able to answer that.
In speaking to Paul, what he told me is he'd be surprised if he actually got up to 50,000. But we're just using the 5,000 as a cushion to make sure that we can get the work done. But I'm expecting it'll come in even less than the 50.
That just went on record, Chief.
Oh, no.
That's what he told me.
That's awesome.
No, I do have
I'll
confidence
take it.
in what he says. And his track record is, would agree with that.
All right, anything else? All right, we have a motion on the floor. All in favor? All right, looks to be unanimous. Thank you. All right, we'll move on to the fire items.
Okay.
Item 1A, authorize the purchasing agent to execute a purchase order on behalf of the Norwalk Fire Department to Norcom CT 7 Great Hill Road, Naugatuck, Connecticut 06770 for sole source purchase of 25 APX 8500s, all bond MP mobile radios not to exceed $177,402. Funds are available from account number noted. Anybody like to move this item? Ms. Johnson, thank you. And Chief Gatto, did you want to speak on the item?
Yes, thank you. Good evening to everybody.
Good evening.
So in last year's budget, we put in to replace our mobile radios that are the radios that are inside the apparatus. So the year before that, we replaced all our portable radios, which are the radios that the firefighters carry personally on them. So now we're into the second phase, which is the mobile radio upgrade. And they're tri-band mobile radios, replacing radios that are 10 years old, and Motorola does not, they're being phased out because they're old. So now this will, it's a tri-band radio, which allows us to communicate with the other surrounding towns and cities. If you go on mutual aid, either to Stanford or New Canaan or Westport or Wilton, we have their frequencies on those radios now, so it'll be easier to talk to them. So the upgrade includes the mobile radio, the radio and cables, and programming of the radios. So that's about it in a nutshell.
Any questions, discussion? Pretty straightforward. All right, we have a motion on the floor. All in favor?
So the money was approved in the budget last year, but apparently I need common council approval to actually write the requisition.
For the radios?
Yes.
Okay. So the vote was already cast, so you're gonna have that'll work. So I think we can move this right to the council. I don't know that it needs to go to finance after this. I think you're all
Okay.
set.
Thank you.
Actually,
Thank you.
Nick, Mr. Chair, can I ask one question? Chief, we've been talking about this for a while now, and obviously we're all looking forward to the new system. Have you heard from any of the neighboring cities or towns that are using it as of yet, or?
Are you talking about what the police chief just spoke about?
No, the radio system for.
Ours is not, mine is not a radio system. Mine is replacing hardware in each of the apparatus.
Oh, okay.
It's the radio that they speak to. It's a mobile radio, like a car radio, but it's a radio that we speak to each other on. And we have the capability of speaking to other towns.
Oh,
as
got
well.
it. So, all right, never mind.
Okay.
Still got my vote, by the way.
Thank you.
All right. Any other confusion on that one? Anyone have anything else on that item? All right. The vote was cast. It was unanimous. Thank you. And then item 2A, authorize the Mayor Harry to be willing to enter into a contract with Morrison McDaniel, management consultant, 1117 South St. Asaph Street, Alexandria, Virginia, 22314, to develop and administer a firefighter entry-level exam not to exceed the amount of $75,000. Do we have a motion? Mr. Keegan, thank you. Deputy Chief.
Okay, so I'm not going to relive what happened during the last testing process for the fire department. The mayor and the fire commissioners decided that they wanted to move forward with a separate entry-level test for Norwalk Fire Department only. Back in November, working with the purchasing department, we went out for a bid for an RFP, and this Morrison McDaniel was the only company to respond to the RFP. So we met several times with them over Zoom several times. And in the January Fire Commission meeting, the commissioners decided that they wanted to move forward and hire this company to administer the written test and the oral portion of the test for entry-level firefighter. And their the actual price for the test is $67,500. I added a little bit extra because we have to do recruitment, and recruitment means we're going to get out into the city and go to different churches and different venues and different areas, and probably have to pay people overtime to do that. So I added a little cushion for that. Basically, the commissioners are confident that they'll be able to establish a pretty diverse list of candidates, because that's what they're looking for. And obviously, we're all hoping that there won't be any problems as we go forward. But the timeline we're looking at would be a spring or late spring, well, probably like April, to have like the written test, followed by the oral, and then have a list established sometime in May. So that's the recruitment will be for like a couple months, beginning once we get the funding and the approval from Common Council and the law department writes the contract. Once we get all that done, then we'll start with the recruitment, which we're hoping by the end of February or March.
All right. Thank you, Chief. Discussion, questions? Ms. Revelous.
So I'm glad you said that, because I was going to ask how the idea of recruitment has happened since we last discussed. Have you guys actually found or thought up the vehicle the recruitment would look like? What would be paid for? Like, are you going to go with the mailers, or are there ideas? The signage. I particularly think it's crazy that I can, again, use a barcode to, use and order a meal in a restaurant, but these are the type of things I could use for information, just to put a phone over. So I'm just wondering, thinking about the venues or the avenues you're using for recruitment and telling people what's going on, just wondering if you have a look to that yet.
We did start to look at how we will handle recruitment. And we did put together a packet of information that's going to go on the city's website. It's not there yet. It's going to go up. It'll be updated on the city's website with a lot of information on how to become a firefighter, what's the test, like kind of what it consists of, the physical agility part of the test that's going to be required. So things like that. The flyers and brochures or posters, we haven't gotten that far yet, but that's a good idea, though, to put that barcode on there that somebody could, that would take you right to the city's website. Is that what you're saying?
Exactly. Like, I think for stuff like this, for even understanding what districts we're in, all that stuff, just as easy as put your phone in front of it. Yeah. Or the signage, the digital signage.
That's a great idea.
Thank you. I try.
Chief Gatto, I think in Barbara Smith's in the community service and personnel meeting, we're going to try to carry something forward around the either potentially digital signage or just public outreach in general from a the community services perspective, and I'll share that back with anything that they come with. I'll make sure that you have visibility to.
Okay, thank you.
Absolutely. Any other questions or discussion? Ms. Johnson.
And Chief Gatto, I know this follows up with Councilmember Revolucion's point about the recruitment. Is that something that the city and the NFD is going to be solely responsible for, or do you have confidence in this? I guess what I should say is this group just preparing the exam and administering the exam, and that's where their work begins and ends?
No, they're going to help with recruitment. They're giving me a name of an individual who has worked with the Norwalk Police Department for recruitment. I just got that individual's name today, so I haven't looked into it yet, but they're supposed to help us with recruitment, probably social media, that kind of thing. They're not going to pound the pavement. We're going to have to do that.
Okay. And what kind of track record does this company have in their return rate on that investment for recruiting diverse firefighters?
Well, they claim they have very good track record. It's a small family-owned company. They've been around for 40-something years. They're out of Virginia. They claim that they've only been to court 3 times and they won all 3 times. Other than saying they guarantee a diversity list, they're confident that they could produce it. So the commissioners like what they heard and their presentation. So that's why they want to go forward with these guys.
You mentioned they've only been, oh, sorry, go ahead.
No, I'm sorry. I don't want to interrupt you. Go ahead.
Oh, no, we're good. Maybe we're thinking a similar thing, but you just mentioned something about them going to court. Is that because they were sued about something or what?
No, because, a municipality might be, somebody might try to sue the municipality by saying that, the questions were not valid or some type of process for the test. They have to validate, every question has to be validated and they prove that they've done that more than once, so.
Okay, thanks for that clarification.
I do have a response for council or the committee member Revolus, I don't know how to say your name. Sorry. Okay.
It's okay. It's crazy.
I was just told by Michelle DeLuca, she said that we did have a QR code last time.
Oh, you did?
When we did the post.
Oh, okay.
It worked out very well. So we'll probably do that again.
Try that again.
Yeah, for sure.
Let me ask you one more thing because but it might be weird because working in, it might be weird to do this, but how many do you provide the information in different languages? Although I would understand how you would want to recruit people that speak English as well, but do we do it in different languages?
That's a good question. I mean, we do it. I don't know, to tell you the truth.
Gino, I believe for the 2015, we did have some of the posters and materials in Spanish. But again, ultimately bringing them back to the city's webpage and the recruitment booklet. And I know with the website, we do have some of the ability to do, I guess it's Babbel, to do some of the translation,
Right.
but some of the materials were in Spanish.
Okay. So being the fact that I would love, because especially if you can bring it back to the website that can translate for, but being the fact that we have like 64 different languages in Norwalk right now, the top 3 being English, Spanish, and Creole. You never know who may see it in Creole that knows someone who's same thing but speak English, whatever, or someone who may have done that in their country, whatever. But we definitely do have over 60 something languages in this community that you might be getting people who are really apt to be there, but again, just it's not getting past them.
I mean, it'll definitely be translated. I don't know about 64 different languages.
No, I completely understand, but it's just that when you say diversity, we are diverse.
Right.
You know what I mean?
Right.
So that's all.
Okay.
Further discussion?
I don't.
All right, thank you. All right, we have a motion on the floor. All in favor? Looks to be unanimous. Thank you, Chief. All right, we'll move on to the old business, and Chief Gatto, you're up first for the any fire updates and discussions since the last time we met. Anything we should be aware of, other than this is probably pretty big for us?
Okay, just some things. I just want to make a note that in 2019, we had 7,228 calls for service. This year, our numbers are down 6,673. And you'll find even the police department, EMS, during the height of the COVID, a lot of the calls were down. So that attributed to, minus 555 calls from last year. Since we had the past assistant chief retire back in July, the fire commissioners decided that now was a good time to bring on another position, another assistant chief in the fire department. So all that was done in December, and we now have two assistant chiefs. One is the assistant chief of operations, and one is assistant chief of administration. So we're breaking down a lot of the responsibilities into these two new positions.
Excellent.
Back in November of last year, let me just get my phone here. At Station 5, Meadow Street Station, we put a memorial plaque up for past Chief Sandy Anderson. So the plaque reads, Chief Sanford Sandy W. Anderson, dedicated to the memory of Chief Sanford W. Anderson for his 46 years of dedicated service to the Norwalk Fire Department and to the citizens of the city of Norwalk, and the years he was on the department, 1959 to 2005. We had a ceremony with Mrs. Anderson. It was really cold that day, and I told her that we were going to do another formal ceremony in the spring when the weather gets better. So I just want you to, if you drive by on Meadow Street, you'll see this on the wall right under the sign that says Norwalk Fire Department Station 5. Just quickly, a COVID update. I think we were pretty lucky. Since the beginning, we've only had 5 positive cases. We do have one member that's still out with type of respiratory problem, but he's getting better little by little. So he's on his way to recovery. Just last month and into this month, we had 5 members retire on disability pensions, which now brings our vacancy count to 11. We were able to get our first vaccine shot the end of December. So we had 71 members get the shot. 38 said no, they didn't want to get it. And 28 said they wanted to wait. And we just got our second shot on Tuesday. But I think that little by little, they're beginning to change their mind, and hopefully they'll be able to get the shot. Just one last thing, we're going to set up a small satellite office in the building code enforcement in City Hall for a fire marshal to do small plan reviews so that either a contractor or a customer could get that taken care of in City Hall, not run back and forth across town to the fire department. So we're working to get that set up probably by next month, I would hope. That's about all I got off the top of my head.
Well, good stuff. Any questions for the chief? Any discussion from the group? Mr. Keegan.
Yeah, hi, Chief. I have one question I've been meaning to ask. We have 5 firehouses, is that correct?
Yes.
Okay. How many of them have proper accommodations for our women firefighters? I know that we had a budget request last winter for Broad River. I know that they did a renovation, part of which was to put restroom facility, showers for our women firefighters. How about the other stations? How do we look there?
Okay. Broad River is still under construction, believe it or not. But yes, there'll be a separate locker room and a separate lavatory for females. Central obviously was built with that in mind. Renovations were done to Van Zandt Street a few years ago. They have separation, because they have doors that close and lock and that kind of thing. None of the stations have like a separate dormitory. What they have now is, lack of a better term, a cube with some type of closure, like a curtain or a sheet. It's mainly curtains. So they have their own space as far as sleeping goes. And the only station, there's two stations that we are working on updating the lavatories. Right now we put locks on the doors and signs that say occupied or not occupied. It's a work in progress. We're not done completely in every station, but we definitely know it's an issue, and we're working toward it. I will say, out of the 4 female firefighters, we told them that we were going to build them a separate locker room at headquarters, and they told us not to do it. They said they don't want to be separated. I mean, the way it works now is you take your clothes and you walk down the hall 20 feet and you go into a little shower area with a door, privacy, and you change. They thought that was fine, and they don't want a separate area. They don't want to be separated in that way. So, but we are working on it.
Okay, thank you.
You're welcome.
Any other discussion, questions? All right, Chief, thank you for the updates. We appreciate that.
You're welcome. Thank you.
We'll move on to Health Department updates and discussion.
Have a good night.
Have a good night. Thank you again, Chief. Hey, Deanna.
Hi, good evening, Council President Sachinelli. How are you?
Very well. How are you?
I'm good. So the big update for the health department, as I'm sure you're all aware of, is we've started vaccinating for COVID-19. We started at the very end of December 29th, I believe was our first clinic. And so we have, at this point, we have vaccinated over 1,000 individuals. And as Chief Gatto mentioned, we started vaccinating second dose this week. So we began with those in phase 1A. So if you remember, the governor has set phase 1A as healthcare workers, the medical first responders, and then also the long-term care facility residents and staff are also included in that 1A. So, the health department, as soon as they had given the opportunity for health departments to receive vaccine, we, signed up and wanted to help do our part. We have about 50 emergency response team volunteers that are assisting in this effort, and that number grows. So they've been incredible. Donna Schlegel is our volunteer coordinator, and Glenn Iannacone is our emergency preparedness coordinator. So they've done a fabulous job coordinating all of those efforts. And again, I say it all the time, but I can't thank our emergency response team volunteers enough for their efforts. We right now are focused on continuing to vaccinate those in 1A. The governor did announce that 1B would begin and would start with those 75 years of age and older. They also announced several other groups that are included in 1B, and that includes the frontline essential workers, people aged 65 to 74, and then also with those with underlying health conditions that put them at risk for a more severe COVID-19. And so right now, the guidance is that we can only vaccinate those that are 75 and older. We're still waiting for guidance from the state to see when we can start vaccinating those other groups. We know there's a huge demand for it and a need to expand. But right now we're focused on 75 and older, and we're, gearing up to be able to expand to those other groups as soon as we can. We're working right now with the VAM system, which is the CDC system, the Vaccine Administration Management System. But we know that it's been challenging, especially for those 75 years of age older. And we also know it's going to be challenging for other groups as we move forward because it's only offered in English. And so it's really health equity and access is really important to us. So we're working with the state right now to transition to use our own electronic health record system. That's really important to us. It's something we wanted to do from the beginning, and the state is now allowing us to make that transition. So we had a meeting this week with our software developers who manage our health record system, and we started talking about how we can put things into Spanish and in other languages. So and we're also thinking about the scheduling starting now, how we can assist seniors. And so the Senior Center and the Senior Services Coordinating Council have set up a system to have a phone line to answer and talk to people, answer questions both in English and Spanish, to try to do some troubleshooting with VAMs. And then we're also trying to work at, being able to schedule people directly. So if, we know there's people who don't have email addresses. We know there's people that don't have the internet. We know, there's people that don't read English. So we're working on that, and that's really important to us to be able to provide that option. There's also, as I'm sure there's the Connecticut Vaccine Appointment Assistant line that's available for people to call to schedule appointments. And there are also several other healthcare providers that are also scheduling directly, like we know Yale New Haven Health and Hartford Healthcare. So those are also other options we're trying to let people be aware of, so that, one of the questions we get sometimes is, I'm a Norwalk resident, but can I get vaccinated in another town? Yes. And other people can come to us as well. So it's a statewide effort, it's a regional effort. So everyone's working together. We have the hospitals, we have the federally qualified communal health centers, and we have several other that are vaccinating. And those are the big highlights. As far as case counts, we've gotten to over 8,000 positive reported cases in Norwalk. I was looking at some of the numbers. Remember that first wave that are back last year. But even now, we've seen some of the highest case counts recently. Up to like 2 weeks ago, we saw the highest case counts. The past couple of weeks, they're starting to go down. We're watching that. We're hoping they continue to go down. The positivity rate has gone down this week. We're hoping that continues. But again, we're reminding everyone to not forget any of the important protective measures, to wear your mask, to wash your hands, and to keep your distance. Because we know that vaccination is going to take months to accomplish, and so we can't remember those important measures.
Excellent. Thank you.
I see Leisha. She has
I do. So Miss King, how are you?
Good. How are you?
Well,
I just wanted to add something to what Deanna was just saying so that everybody understands. As Deanna mentioned, Norwalk residents have the ability to register for appointment through VAMS and get their vaccinations in other locations. So when we're reporting that we've done 1,000 vaccinations through the health department, that's only a portion of Norwalk residents who have had the ability to get the vaccine. I know that that's been something that has been confusing for people about, how come we've only done 1,000 people out of 90,000 people. And I just wanted to really clarify that what Deanna is reporting out is the efforts that the health department itself is making, which are amazing and well beyond what many other towns are doing. But Norwalk Hospital is also vaccinating. Our health clinics are vaccinating, and also people have the opportunity to be vaccinated really any place that they can get an appointment. One of the things that we have asked the state is whether we can get a report on how many of our residents have actually gotten vaccinated throughout the state. And so far, we haven't been able to get that data, but I just wanted to make sure that everybody understands that the portion that the health department is doing is just a fraction of the total vaccination that's happening in the community.
Excellent. Thank you. Questions, Ms. Revelous?
So I already, thank you, already know where my question's gonna go. And I really will be honest, I need to employ the importance about this. Where is the health department on communicating the importance of nutrition to the community, children, families, period, for not only COVID, but for all diseases that we're dealing with or dealing with discrepancies for? Where are we with discussing nutrition for our communities, A? And then secondly, from a constituent that I've talked to, I know that there's misleading uses about like how people should be properly wearing masks now, like people are trying to wear 2 masks and so on. So probably how are we talking to like reminding people on the proper use of what the CDC says is a proper usage of masks, but again, imploring where are we with the conversation on nutrition with our community?
Teresa, can you start?
Sure. Hi, everybody. I'm Teresa Argandesi. I'm the health educator at the health department. Right now we're doing a lot around nutrition. The Healthy for Life Project is a community coalition that we established several years ago with lots of other organizations to address nutrition and physical activity, chronic disease, self-management. And so through that group, we're doing, right now, a lot of the work is on food access because food insecurity is such a difficult issue right now. So in addition to getting the word out about what food resources are available in the community, we're also doing some education through videos and flyers around how to donate healthier options so that when folks are accessing charitable food experiences, they're getting healthy food and food that can help with any chronic conditions that they might have. So in addition to working with Lamond and the Community Services Department on the actual food distribution, educating the community on how to make healthier donations, and then also we have some materials on our website around boosting your immune system through nutrition that our registered dietitian developed. And she's also been working very closely with the Food Corps service members who are stationed in Norwalk Public Schools in a few of the, I believe, elementary schools in town. They work as a bridge between the students and the food service department, to incorporate nutrition education, as well as, hands-on taste tests and those kinds of things. I think some of that work has been limited this year based on, precautions. But the registered dietitian is providing them with her expertise. They do a newsletter in English and Spanish that goes out to all the students and their families. And our dietitian helps support kind of drawing the connection between what the Food Corps service members are teaching in the school district, how families can incorporate that information at home, making recipes at home and talking with kids about those lessons. And then also what's out there in the retail environment. So if they're, stopping by the grocery store or, grabbing something to go, or even dining out at a restaurant, we have an Eat Well Healthy Restaurant program that tries to encourage people to choose the healthy options that are on the menu at those places. So those are some of the things that we're doing right now. We have, been limited in our ability to do in-person education. We've held a couple Zoom calls with the public library for their Healthy Resolutions program, trying to help people who've made healthy resolutions during this difficult time, come up with strategies and ways that they can stay healthy while taking, COVID precautions. And I'm sure I'm forgetting some things, but that's
I would love
the bulk of it.
I would love to A, be a part of those, but B, see those being advocated and distributed just as much as we're talking about these vaccines and masks. Like, let the community understand that these are a part of it, and that, maybe the options that we do donate will change because of the healthy conversation around food and dietary changes. And even once again, I can put a phone in front of us, barcode to learn things. Whatever we can do during post or past pandemics for not only COVID, but again, hypertension, diabetes, multiple sclerosis, whatever, having a healthier community through and through would be amazing for, I think, as a civil servant to see our constituents through and through, children to adult, you know?
Absolutely. Agreed.
Thank you. And since you're both, your images are on and everything, great presentations last night during the town hall. That was outstanding information. So thank you both for that as well. I know Mr. Huthman was on, he had some great comments, but we had some phenomenal information. And those of you on the committee or who might be joining remotely that did not see it, it's on the city website, it's on our YouTube channel. And I recommend that we share that out whenever possible. There was a lot of good information from contacts and websites, and the content was great. Thank you both. Any other questions for the health department? Ms. Shanahan.
Yeah, I'm just interested to know how you're combating the idea about people not taking the vaccine, about the anti-vaxxer type of information. It seems like there is, just listening even to Chief Gatto, there seems like there's a little bit of resistance. And I wondered if you're seeing that in the community and how you're addressing it.
Sure. So we are seeing some, hesitancy at first, but we also are seeing, as more time has passed and more people, as peers are becoming vaccinated, more people wanting to be vaccinated. But that's something we're very much aware of in terms of just making sure everyone has the right information they need to even know about the vaccine, to if they have questions. And so Teresa has been doing a lot of outreach and communications related to the vaccine to different groups. And Teresa, I don't know if you want to mention just briefly some of that, of what you've been doing.
Sure, just a couple Zoom calls and info sessions, one directed at early childhood care providers, because the daycares and preschools will be among those who are eligible in the end of phase 1B with frontline essential workers. And our director of early childhood in the city reached out to me and said she thought it would be great for them to have an opportunity to ask questions. I just recently did one for the staff at Person to Person Food Pantry, who will also be eligible likely in phase 1B later on. And we did one for city employees, and I'm blanking. I feel like I've done a few more than that, but we're also planning to schedule a few more coming up. So, and just like Deanna said, provide the basic information, address, common myths that we're hearing out there. And, just be really straightforward. I think something we've talked about all the time is it's totally natural to be hesitant, right? This is a brand new thing where, people are just learning about it. So it's normal to think, I feel like I want to do some research, or I want to talk to a lot of people before I make a decision. And so our job is to just be there and try to get all the real, legitimate, science-based information out there so that people can make a decision for themselves based on facts.
And also, I just would like to add, participating in the mayor's task force, the whole communications and messaging component of it too, to be an active participant in that and to support those efforts.
Any other questions? All right. Well, thank you both. And now we're on to the last discussion item under old business, police updates and discussion. Chief, are you going to take this one?
Yeah, I can take
Yes,
that.
sir. Excellent. The floor is yours.
Well, first, I think Deanna might have signed off already, but I just want to give her and Teresa and her staff kudos for the organization of the vaccine clinics. They did a tremendous job putting together, organizing it. We went through the second shot Tuesday, and it was done so well and so well organized. It was really they've done a great job, considering it's the first time for all of us trying to deal with this. So not related to the police, but I just wanted to say that. As you've seen in the news, we've had a challenging month, so to speak, and I'm hoping that things will improve from here, both for me and for the department. But from the department point of view, as far as the COVID situation, we've actually are in pretty good shape right now. We're in the best shape we've been in probably several months. We only have, I believe it's two officers out with COVID from on-duty exposures and one with an off-duty exposure. So we're only down 3 total right now, and we've been down as many as 8 to 10 or 12 at some points with quarantines and things. So things have really improved in that regard. And as far as the vaccine goes, we're similar to the fire department. It's about 50-50 that volunteered for the vaccine on the first go around. But we did speak to the health department. We've uploaded all of our officers into the VAM system. So as time has gone on, more and more officers now have seen people take the vaccine, have learned more about it, and we're seeing more people take advantage of the vaccine. So I think the numbers are going to continue to improve in that regard. You had sent me an email regarding a couple discussion items you were interested in. And one of them, but I'm not sure what you meant by it, but one of them was an overall, I'm sorry, I'm trying to find it now.
Just so it's on record, Chief, maybe I think those questions came from Ms. Johnson. Maybe did you want to ask the question?
There was one that said an overall discussion on the accountability bill or accountability.
Yes.
I wasn't sure.
Yes,
I wasn't
that's
sure
what.
I'm sorry.
No, was there just any type of brief overview for the committee on the what was put into place? I know there was some things from a personnel perspective as well as some updates to the vehicles.
Oh, okay. I'm sorry. Not the bill, but for departmentally. I'm sorry. I misread it.
Yes.
Yeah.
Yes, sir.
So what we've done, and it's not just because of the incident we had, but we're always looking at improving. And what we found as we were investigating the incident with the two officers, we determined that the vehicle locator system was not working properly. As we were auditing the vehicles, we found that several of the vehicles not involved in this incident per se, but just in general, were not reporting back their locations and things. And we had no way of knowing that because it doesn't tell you that they're not working until you look and try to find them. So as we looked into it more, we decided that we needed to do something different. Unfortunately, the city individual who was managing the AVL system retired and took a job in the private sector. So the city system is no longer something that we can utilize. So we're looking at an outside vendor to improve our overall tracking of vehicles, the AVL. And that's something that's budgeted into the new July 1 budget to move off into a private vendor and really get a good AVL system in place. So that's one thing that we found. And then another thing that we looked at was with the changing technology, the increase with the dash cams coming on, the AVL system not functioning and not being aware of that until we actually looked. We decided it was a good time to try to get someone to focus on just looking at those kind of issues on a full-time basis. It's gotten very complex. We've been asking our officers and our specialty units to do more and more and add more and more onto their plate. And obviously time, they just can't do it. So we added a lieutenant in an office we call compliance and accountability. And what he's tasked to do is basically do inspections, review the AVL systems, review our body cameras, review the dash cams once they come online. He's also looking at our internal surveillance cameras, the citywide surveillance cameras that we have in the schools, et cetera, to make sure that they're functioning properly. And if they're not, he did an audit of all our vehicles and our radio system to make sure that the vehicles and the radios are matching. As the radios are installed in a vehicle, they have to be matched up so that they know in dispatch that radio X is in vehicle Y. And we had a few vehicles that were not properly documented in the system, so we've corrected that. So it's worked out well thus far. We're giving him more and more responsibility. Something else he'll be starting to do is on a random basis calling officers in and have their vehicles inspected, make sure that the equipment's in place, that it's working properly. So I felt it was a good time, and I think it's something that was that's going to really help us, again, keep accountability and make sure that things are working the way they're supposed to be. And the individual that we assigned to that is a very task-focused person. I think he's going to be a good fit for that position. So I think as far as that, the accountability point goes, unless somebody has any more questions regarding that, then before I move on to something else.
Yeah, I think Mr. Keegan had some comments that he wanted to bring up, and Ms. Johnson had some questions as well. So I don't know who wanted to go first or if anybody else from the committee wanted to.
Dominique, please go. You can go first. That's fine.
Are you sure? Because I know you were mentioning earlier. All right, I'll be brief, hopefully there. Then
I hope I will too. Okay.
All right, good. Well, I guess we were talking about the accountability bill just now, so maybe I'll leave with that, Chief. And thank you, Chair Secondly. I know the accountability bill is mandating to have mental health evaluations at least every 5 years. And I've heard from, I mean, there are those, and I've even heard from constituents about, well, why not 3? So I'm just curious from your perspective as a leader, what if the accountability bill is every 5 years, do you think that's sufficient enough to be able to flag issues and help officers get the help they need given their line of work? What are your thoughts about doing that more frequently, let's say every 3 years?
Yeah, well, I think it's important to keep in mind what we're talking about. And just to give you an example, when an officer is hired or before they're hired, there's a full psychological examination that's done. It's basically a day-long psychological evaluation. It's very, very involved. It's very expensive, but it's very involved. The mental health checks that are mandated by the police accountability bill don't reach anywhere near that level. The mental health checks they're talking about is 45-minute kind of check-ins with officers. It's more of a mental health wellness for the officer themselves, as opposed to trying to root out if there's some underlying issue that's going to cause something like what we've seen. And I don't think that would have rooted that out anyway with the mental health checks that we're talking about. If there's an officer that we find exhibiting something that we feel needs to be further reviewed, I have the option to order a fit for duty examination. And that is, again, a comprehensive, several $1,000, really comprehensive evaluation by a psychiatrist to determine that the officer is mentally fit to remain on the job. We've invoked that a couple times. I haven't, as the chief. It's rare because you need to rise to a certain level to be able to have the power to do that. So what the accountability bill is mandating, I think, is a good thing because it's going to help the mental health and wellness of officers when it comes to stress and marriage issues and PTSD and those kind of things. But I really don't think that it's going to really have much of an impact on whether or not they're prone to some kind of abhorrent behavior or something like that. I'm not a psychiatrist or psychologist, so I'm just speaking anecdotally from what I've seen and what I know, but what I'm aware of. But I think it's a good thing, but I don't know that increasing that for the cost is really going to have any real impact. I think that doing it every once every 5 years is much better than what it is. I know there's some small agencies in the state that do mental health checks every year, this kind of thing, but they're agencies with 10 to 20 officers. So it's much easier to do. It's not expensive. We budgeted in our new budget for the mental health checks as well as the drug testing, and it's added a significant amount to our budget, given that we have 180 officers. So it's not an inexpensive thing to do. So I don't know that doing it more frequently would have that much of an impact, personally.
Ms. Shanahan.
Just to follow up on that question, Chief, didn't you tell us at one point that you have some triggers that sometimes set you off to bring some of those health checks earlier? For instance, if there's a number of absences or an incident or things like that, can you fill us in about some things that might trigger you to look at an officer sooner than every 5 years?
Yeah, so as part of the accreditation process, we've had to do an early warning system, have it in place. So what we've been doing for the last since 95, so I don't know, whatever that is, 15, 20 years or more. We've had this early warning system. It's been a manual system where we track car accidents, use of force, sick time, pursuits, trying to think, any of these unusual activities that occur. And if somebody exhibits that they've had an unusual amount of something, then we'll take a closer look and see if they need to be spoken to or be sent for EAP or whatever. Last year in the budget, we were approved to begin a new software program called IA Pro, which allows us to input everything and be a more automated system where it'll automatically, as we enter data, it'll alert us automatically when certain triggers are met. And right now we have somebody inputting all that data. So it's not still up and running, but it should be shortly. So yeah, we do look at that. But again, despite and I spoke to the psychiatrist or psychologist that does our pre-employment evaluations, given what's occurred, to try to get an idea of what we could see, and unfortunately, human behavior is human behavior. And as much as you try, and you try to do what you can, there's going to be those things that occur that are just outside of what we can predict. Human behavior is just not predictable sometimes, but we continue to strive to do our best to try to look at areas where we can try to identify those things. But there's going to be those times that it's just not going to be something we're going to see.
Thank you, Chief. Any other questions, comments, discussion? I see Tom pointing. Ms. Johnson, I think it's you.
I was just pointing to Tom, so I guess stand off, Tom. I'll just keep going. Thank you. All right. Just really quick, Chief Colwick. I presume that Officer Blake is still the LGBTQ plus liaison.
Yes.
There'll be a second LGBTQ plus liaison added as well? Or is that all Officer Blake now?
Is that what? I'm sorry.
Will there be a second liaison added, or is Officer Blake the main liaison? Because I know there were two, and one of the officers is no longer the liaison. So are we expecting another to replace that officer, or is it all Officer Blake now?
No, actually, Lieutenant Blake has always been the liaison. When he was in
That's
community
right.
police, when he was in community policing, he
Okay.
started that program. So he's
Awesome.
always been the liaison. We've had other officers that have assisted him, including the one.
Oh, I see. I just saw on the website there was another officer listed.
Yeah, she was very active and did a great job actually in creating those relationships.
Right.
Right now, Lieutenant Blake is still in that position, and even though he's not in community policing, he still is on several citywide committees that include the Triangle Community Center and others. So he still is in constant contact. So he still performs in that role. We do have other officers who are interested in helping when we have outreach programs. Unfortunately, with COVID, we haven't had those programs like we did. But once normalcy returns, so to speak, and we can actually face-to-face meet and that kind of thing, we definitely have other officers assist them.
Great. Yeah, no, I've always been impressed with Lieutenant Blake, so I just wanted to confirm given the recent events. So thank you for that. Last question, I promise to be brief. It has to do with the recent events coming up. Again, I've heard from some constituents about what your thoughts are or recommendations would be about creating a citizens advisory subcommittee under the police commission in a way such that wouldn't require charter revision if possible. So what are your thoughts on that?
Yeah, I think if there was a citizen advisory board underneath the police commission, that would require a charter revision if it was a formal system, so to speak, set up in the city. If it was an informal type advisory board, I would not think that would need charter revision because that would not fall specifically under the police commission. And I would have no issue with that. In fact, we've talked about it for a while now. Before COVID hit, we had talked about, I was at the IACP conference in October of, oh boy, time flies. So it was October of 2019 and attended a seminar with some agencies that do have an advisory board like that. And I did come back and we discussed it amongst my deputies about seeing how we might be institute that here in Norwalk, just to present policy changes, ideas, get input from the community on a more formal basis. So no, I'm definitely open to that. Unfortunately, again, with COVID, it's not something we've really focused on over the last year. But I think the difficulty is trying to select the right people and the people that are there for the right reasons and that want to work towards a positive goal. So that's going to be the challenge, is getting the right people in place if we do that. Because no matter who you pick, there's going to be others who are going to be upset that they're not. So I think that's going to be the challenge, is, getting people in place and not, upsetting others that want to be part of it. Because if it's too large, it's not going to be effective. So, but I'm all, in essence, we do have a citizen advisory all the time because, my door is open, my email is there, my phone is always open. I'm willing to speak to anybody at any time about anything. So whether it's formally an advisory board or just people that have an interest, it's fine with me. I'm always open to ideas.
Thank you, Chief. Miss Revolus, or Tom, you've been waiting a long time.
Tom, go, Tom.
No,
I'll wait.
Diana,
Tom.
please. I'll be last. I'll be fine. Thank you.
Okay. A couple of things I just want to say, especially with Councilwoman Johnson, a lot of what she stated has come from the Black community several times, especially with community policing. From 19 to now going on 37, I have to say, coming into Norwalk, I've had very different questionable interactions with the police department that I think we really should consider. Again, why is the training? I know we may have the longest in Connecticut, but I mean in the country, but I still think trainings, particular things that we're talking about now, should really be implemented right in the beginning, like questioning people's personalities, what their intents, their mentality, all of that. I don't think should be so lackadaisious in a sense. Lastly, I just wanted to bring up, and this is kind of random, but I just wanted to put out a special shout out to the fact that we've reached a little over a year for Officer Ramirez's passing. And I just wanted to put a shout out to that and wondering if there is anything being done for Officer Ramirez, especially how impactful he was with directly being a part of the community and listening to their words and their engagement and really hearing their plight when they say it. For how long I knew him, I didn't know him for his duration completely, but for what I knew, he was very active in that plight of hearing the community. So, and that's a double thing. It's kind of like double backing on the need of what Ms. Johnson said, and just calling out the fact that you guys, we have passed the year for a very profound officer that was in Norwalk, and I just want to be able to state it out.
Yeah, you can't state his name enough.
Yeah.
He
I would really love to see like a plaque or a street or something, but we'll talk.
Actually, before you came on the council, they did approve renaming part of Chestnut Street for him.
Okay, yeah, great.
Unfortunately, because of COVID, the actual ceremony hasn't occurred, but that's in the works. And I believe the hope is that once summer comes, before school gets out, we wanted to have the ceremony when the kids were still in school. So hopefully maybe in May, well, again, depending on COVID, we can do something to actually formally, present the sign and do that. But I'm in contact with Anna regularly and speak to her a lot. And we all are still, kind of shocked with his loss. And, he was a close friend of mine, and I still miss him. And he did a lot for me and for the city. And we can't do enough for him. I agree with you.
Chief, I'm just going to jump in right there. You're absolutely right. Public Works, we already set it up. We are doing the street naming. Again, it's because of COVID. And we wanted to do it when everything was open because we wanted the kids to be there and we wanted the family to be out there and the community to be a part of it. So, but it's already been approved. It is it's in the works.
Great. Thank you. Sorry. Thank you. But just to say, I agree with you, Ms. Johnson, on what you were saying. Councilwoman Ms. Johnson.
All right. Anyone else before Mr. Keegan? All right, Tom, I think you're up.
Thank you. Thank you, Mr. Chair, but I've been waiting so long, I've forgotten what I wanted.
Start at the beginning, Tom.
I want to just begin, and this is not a question for the chief. This is a statement. I want to say that one of the reasons I like this committee is because most of you know that I've been a police officer for a long time. And the questions you ask make me look inward. And I look at, myself and my own career. And it's something that just makes me better at what I do. That being said, one of the things that should be of note is that our police department has a number of accreditations from organizations across the country and in Connecticut. And I was looking at them, and one of the things that they look at is comprehensive and uniform written directives that clearly define authority, performance, responsibilities. They look at your policies. They look at your procedures. They look at how you do things. They look at your investigative tools and techniques. I do want to say that the recent events that Chief Kahalwick spoke of earlier, we've all been thinking of them. And I just want to say that I believe that the real goal of any police investigation is to find the truth. And at the end of the day, when the investigation is over, I believe that if our police department ends an investigation, that they find the truth. And I think in the case with Senator Duff, I think that the truth did come out in the end. I do believe that Chief Kahalwick did mete out discipline that was appropriate. And I do want to say that I have the utmost confidence in the Norwalk Police Department to continue to keep our community safe. And I do believe that Chief Kahalwick does have the ability to lead our police department, and I want to thank them and him. Thank you.
Thank you, Mr. Keegan. I completely agree. I concur entirely. Mr. Langella.
And just to second some of the things Mr. Keegan has said as well too. I appreciate the open and transparent dialogue that we're able to have with you, Chief Kahalwick. A lot of these are not easy things to talk about. So the fact that you're here and fielding these conversations and meeting them head on are certainly not easy. And I think, while we can agree that no department's perfect, we are, I think, have a bit of a blessing with the fact that we can have this transparent dialogue and communication and follow up and these action items. So definitely we thank you as well. So I appreciate all your hard work on these initiatives too.
I appreciate it. And I'll never tell anyone that I'm perfect. I'm far from perfect. I know I make mistakes. I make mistakes every day, but I can tell you that I do my best and I try to do what's best for the city and for the community and never look at myself first. So I've run my career like that. That's why I think I've been here for 40 years almost, and hopefully a few more. My plan is anyway.
Meetings in the short time that I've been on the council. So thank you so much.
Mr. Serenides.
Thank you, Mr. Chair. I just want to echo Councilman Langella and Councilman Keegan's comments. Chief, I just want to compliment you. It's definitely a very tough time right now. We have a lot of challenges in front of us. You're doing a great job. You have a diverse, great department over there, and we can't judge everyone or the whole department as a whole for a couple of bad apples or maybe one or two bad situations. Yeah, you're doing a great job. And again, I just want to compliment you and your department.
I appreciate it. Unfortunately, it's embarrassing for me. It's embarrassing for all of us. And, we have to own what happened. It is what it is, but we got to move on. And even when it comes to the Senator Duff situation, I'm just hoping we put it behind us and we just move forward and we start from here and go forward. I'm tired of looking back, and I'm tired of the media, rhetoric and the back and forth and the blogs, and it's just a distraction for everybody. And it's time to just move forward, and we got a lot of work to do, and let's just, get to it and stop looking backwards and arguing about, there's two sides that are always going to be fighting, as we've seen in the country, and we see it in Norwalk. And, I stopped looking at the blogs. I'm just tired of it. We need to just, to get past it.
And I think you're all aware, but I may have buried the lead on this one. Not only is the chief here for discussions, he's taking over this committee, so he's going to be here for us full time as well.
No, temporarily.
Temporary.
Until the COVID's over and Deanna takes it back, because she's been overwhelmed. So the mayor asked, and I never say no to the mayor. So we said we're happy to take over the coordination of the agenda and things.
And we're very happy to have you. So thank you for that.
My executive assistant is pleased to be doing it. Believe me.
Any further questions for the chief? All right. With that, I think everybody received the executive session invite. Did everyone receive that link? All right. Larry, how do you want to do this? Are you still on, Larry?
Yes.
How are you, sir? Are you gonna hang? Do you want me to hang on this one as everyone else goes into the executive session, or? Actually,
I'm going to start it from my phone right now. That way, everyone can just get on.
Hey, Larry, can I ask? I don't know. Did I get that link?
Nick, can you send him the link?
Yes, sir.
Can you send me that link too? I'm not seeing
Was
that.
that, unless,
my
was that the one
email.
that
It came
came
from
like,
Rebecca.
Rebecca, hold on, let me check.
Came from Rebecca at, what was it, at 4 p.m.?
Oh.
4:01
4:01
On
p.m.
Tuesday.
on Tuesday.
I'm forwarding it now. Diane, I'm sending it to your city email. Is that all right?
Yeah, that's fine. I'm checking in mine now. I just realized my screen was like.
Nick, could you forward that to me? I could
Yes,
search
sir.
for it, but if you
No,
have it.
I'll forward. I'll
You
forward.
said
It's coming
Tuesday
down.
at 4 p.m.?
Anyone else? Anyone else? All right, everyone. That's good. Coming out now.